Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Every day, some 800 million women and girls menstruate globally. Being able to manage their menstruation safely, hygienically, and with confidence and dignity is critical, not just for their health and education, but also for economic development and overall gender equality. Millions of women and girls were already struggling to meet their menstrual needs before the current crisis. The coronavirus pandemic highlights or even makes worse persisting challenges related to menstruation. Last week, Ngora District Woman Member of Parliament Jacqueline Amongin asked the Speaker of Parliament to task government to provide sanitary pads, especially to women in isolation and quarantine centers.
I happened to have been in Ngora, I was in Soroti, and I was in Bukedia. And one of the outstanding issue that came out from the both of those victims in the isolation centers were majorly on the female side. That was in regards to addressing issues of their sanitary pads.
Amongin wants menstrual health and hygiene included in COVID-19 emergency response interventions and policies across sectors, including health and education.
High school dropout rates, especially among girls, it's actually lack of access to sanitary towels, especially if these girls are from rural areas and not from well-to-do families. The African Agenda 2063 and the Sustainable Development Goal Agenda 2030 will not be achieved of saying everyone must go to school, because enrollment will be high, but retention of both boys and girls will be very low. And then we also need to get male activists.
The social stigma and taboos surrounding menstruation often affect women and girls, hindering them from reaching their full potential.
You find that even parents fear to talk to their girls about menstruation. It's even worse when you don't have a mother, or so it becomes hard. Men cannot talk openly about menstruation because actually if you're not putting on a tight shoe, you cannot know how tight your neighbor is on a tight.
Following Amongin's call, local non-government organization AfriPads donated a batch of reusable pads to be distributed to women in quarantine centers.
So we donated 500 menstrual health and hygiene kits. So the kits contain a pad, reusable sanitary pad, a pack of reusable sanitary pads, in addition also underwear and a booklet about menstruation in general.
We are going straight away to come up with a distribution list and distribute these sanitary towels.
So in the standard 4-pack of AfriPads, we have 4 reusable sanitary pads, 1 maxi pad, which is for heavy flow, and 3 normal maxi pads. So the 3 pads are for when you have normal, light to normal flow. So that's what's in the pack.
However, Gertrude Adeke, who speaks for AfriPads, says they are cognizant of the fact that menstrual education is still lacking.
As AfriPads, we developed a curriculum, a menstrual health and hygiene curriculum, in collaboration with WOMINA, an organization that helps break some of that stigma and taboo and encourages people to talk about periods.
On the other hand, Amongin says the lack of access to sanitation infrastructure must be prioritized by government.
But also the motion we had brought in Parliament was talking about a comprehensive approach. We're not talking only about menstruation by provision of pads. We're also talking about the changing wear within the school environment. Because you find that as per now, our policy talks about a pupil toilet ratio should be 70 students. But if you go to most of the schools, you find that almost 500 children, 500 learners are sharing one toilet and one bathroom. If I'm a menstruating girl, it will be very hard for me to go and change my pads in that same place where I'm sharing with the boys.
We need to increase the access by things like removing taxes on these products, because it's an essential service. It's a basic that a woman or a girl needs.
A pack of sanitary pads costs 6,000 shillings on the market. A girl would require 144,000 shillings for a year to ensure that she manages her menstrual periods well. To some, this sum is pocket change, but a great number of girls in the rural setting drop out of school because of failure to access pads. In 2015, the president pledged to provide pads for school-going children, but the pledge would later hit a dead end after the First Lady told the country in January this year that there is no money to fulfill this pledge. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.